Good morning, everyone, and welcome, first of all, to the European Health Management Conference 2024, and also welcome here in Bucharest. As Professor Bladescu was saying, we arranged very good weather for you, besides the wonderful conference that's coming in the next 2 days. My name is Teodor Blidaru. I am part of the co-host here in Bucharest, and I will be the master of ceremonies in the next 2 days, so you will be hearing from me a lot as the moderator. And it is my pleasure to be here in front of you and to moderate this first EHMA conference that's happening in Bucharest. It's an honor and privilege for us to host you here, this great assembly of minds in the area of health management, and we are so looking forward to exchange best practices with you. Before introducing our speakers for the opening ceremony, I would also like to thank the EHMA team and colleagues who made this conference possible here, alongside all the colleagues from Romania, from the Ministry, from the Institute of Health Services Management, from the WHO office, who contributed to bring this event here. It's a wonderful experience for us, and we hope the next few days will be enriching for all of us. This conference is organized, as I said, by the European Health Management Association, and is co-hosted in Romania by two institutions, the Ministry of Health and the EHMA member, the National Institute of Health Services Management. It is my pleasure in the opening to introduce first the President of the European Health Management Association, Professor Sandra Buttigieg, President of EHMA, and a Professor and Head of Department on Health Systems Management and Leadership at the University of Malta. Professor, you have the stage for the opening speech. Thank you.
Dear Minister, Professor Dr. Alexander Rafila, thank you for actually inviting us to this beautiful city and this beautiful country. We've already exchanged a few words. It's my first visit, and what a lovely city you have. My dear friend, Professor Dr. Cristian Vladescu, the General Director, National Institute of Health Services Management, Romania, and my dear friend Teodor Blidaru, Master of Ceremony. Again, thank you for hosting the European Health Management Conference in Bucharest, Romania. I would also like to acknowledge my dear friend, Dr. Thomas Zapata, who's representing the regional office, WHO regional office in Denmark. Dear members of the European Health Management Association, dear colleagues, friends, on behalf of the EHMA Board of Directors, I would like to extend you a warm welcome to the European Health Management Conference 2024. This year's theme, Shaping and Managing Innovative Health Ecosystems, encompasses the entire spectrum of health megatrends. From the digital transformation to the growing importance of sustainability and the skill needs of the healthcare workforce, we want to explore with you how the health sector is adapting to these changes. In the true spirit of EHMA, we emphasize an ecosystem approach. We facilitate dialogue on how different healthcare actors can work together and leverage each other's strengths to drive innovation and address pressing challenges. Since its inception, the European Health Management Conference has served as a forum for promoting discussions and sharing innovative solutions. We indeed bring together a wide spectrum of healthcare stakeholders, including healthcare managers, leaders, researchers, academics, policymakers, and industry representatives. This diverse expertise enhances the dialogue on pressing health management issues. This year, we are honored to have the conference co-hosted by the Ministry of Health of Romania and our member, the National Institute of Health Service Management in Romania. And I would also like to take a moment to acknowledge the support of WHO Europe and the WHO Country Office of Romania in the organization of this conference. Over the next 3 days, I warmly invite you to make the most out of the rich program that we put together for you. And among the over 50 sessions, you will find plenaries, abstract-driven sessions, panel discussions, and workshops. You will also have several opportunities for networking with colleagues from around Europe and beyond. On this occasion, I would like to take the chance to acknowledge the support of the many partners of this year that this year made this conference possible. Indeed, on behalf of the Board of Directors of EHMA, I would like to thank our headline sponsor, Pfizer, that has organized 2 insightful sessions on vaccinations. One is later today on pediatric immunization, and one is on Friday on life course vaccinations. And I warmly encourage you to attend these sessions. I also acknowledge the support of long-standing partners of EHMA, Philips, that has organized a session on access to care with a specific focus on stroke, and MSD, whose session focuses on the burden of pneumococcal disease on health systems. This year, we welcome a new partner, the European Alliance for Value in Health, that will have a very interactive workshop on value-based healthcare tomorrow that, of course, you do not want to miss. So I encourage you also to attend that session. We also acknowledge the support of the European Observatory on Health Systems and Policies, the Univans Award for Healthcare Excellence, and Health Assessment Europe. I would also like to thank the EDHTA and the Expand DH projects who entrusted this conference for the dissemination of their activities. Last, but certainly not least, the Karolinska Institutet Medical Management Center, supporting once again the PhD award, and Candia, that donated the sweet treats you are enjoying from your welcome bags. In closing, I would like to make a special mention to EHMA's flagship project, Be Well. The Be Well project that EHMA coordinates counts on a consortium of 24 full partners and 5 associated partners, among which several EHMA members. Last year, at the conference in Rome, we launched the first version of the project's skills strategy for the digital and green upskilling, as well as reskilling of the health and care workforce. Now we want to hear from you. We will launch an open public consultation so that you can tell us your views on the Be Well skills strategy. If you want to know more, I invite you to attend the dedicated session on Friday. Again, on behalf of EHMA and the Board of Directors, we are elated to have you here to discuss how we achieve excellent health management for a healthy Europe. Last but not least, I would like to thank my colleagues, the board, the board directors, my team players, so to speak, as well as the secretariat, led by Federica Margheri, for making this conference possible. Thank you.
Thank you very much, Professor. Indeed, it's already 1.5 years since we started the communication for this conference to happen here. The collaboration with the team from EHMA was wonderful, and this is the result, and the next few days will be the result. So thank you for that. Next, I would like to introduce Professor Alexandru Rafila, the Minister of Health from Romania, a minister of which his term had a special focus on health workforce and health services management. So it's important that this conference is happening here after 2 years of the term, because 2 years ago, a reform in health management started in the country, and I'm sure the minister will tell us more about it. So this is something that continues on the work of the minister and his team. Minister, the floor is yours.
Good morning, Professor Buttigieg, dear members of the European Health Management Association, ladies and gentlemen, dear colleagues. First of all, I want to say that we are honored to co-host this important European meeting with almost 400 participants coming from 45 countries. And I don't know, maybe my colleague, Professor Vladescu, will confirm or no, maybe it's one of the most important or the most important event on the public health field hosted by Romania. First of all, it's my pleasure to wish you a warm welcome in Bucharest. And as I told you, we are honored to co-host this important European Health Management Conference. And also, I am very glad to introduce our specialized agencies, the agency of the Ministry of Health, which is the National Institute for Health Services Management of Romania. It's an old institution, more than almost 30 years, I think. It's changed in time, and now we are ready to help the reforming of the Romanian health system based on the professional of this important institute. The ambitious theme of this conference, Shaping and Managing Innovative Health Ecosystems, will give us the opportunity to discuss the latest updates and best practices in a wide variety of health topics such as digital transformation, health workforce, better management processes. And I should add something which I saw on the program of this meeting, this melting, this combining, this integration of, let's say, all the public health action as immunization with new developments like the implementation of artificial intelligence in all the health processes. I think it's one of the most challenging and one of the most important things we can develop and to learn during this conference. Something else I should add, and my colleagues prepare me some concrete information regarding this event. We received for this event almost 300 submissions. It's the highest number of abstracts submitted for this type of conference. There are 48 sessions between plenaries, panel discussion, workshops, abstract session, and scientific dialogues with more than 200 speakers. I think it's impressive and reflect the importance of this meeting. I want to add one of our milestone and to congratulate especially my colleagues from Romania, professors, researchers, managers who are here and who submitted abstracts for the conference. And also I'm happy that almost all sessions and panels have at least one Romanian speaker. It is a very good sign because in the last 2 years and a half, since I am the Minister of Health, and it's not important because I'm Minister of Health, it's important to have the continuity and to develop this, not only the topics, but concrete measures in the area of management of health services, and it is one of our reform. We have to comply in this new plan for recovery and resilience. And Romania have one very important partner, and this partner is WHO Regional Office for Europe and the country office, and with their support and also of 3 important public health schools, EHMA Business School Barcelona, Nova School from Portugal, and the University of Milan, and of course EHMA courses. We are ready to train and to change the perception regarding health management in Romania. So I should add something which is also in our focus, and I'm sure I saw the program. It will be discussed during this important meeting. We adopted last year the Bucharest Declaration on Health and Care Workforce during the high-level WHO meeting, which took place in Bucharest. Then this resolution was adopted in the regional office in Kazakhstan last year. And these topics on the health workforce, it's on our focus, and I'm sure that every representative of a country who is here have something to say regarding this subject, and we have to find some good practice models adapted also to the country profile. But anyway, this is also very, very important in my opinion. Now at the end, I want to thank to the team of European Health Management Association led by Professor Sandra Buttigieg and as a president, and also by Mrs. Federica Margheri, executive director, for the very good collaboration in organizing this event, as well for all the work done for the development of health services management practices and education in the European region. I also want to thank the team led by Professor Cristian Blădescu from the National Institute of Health Services Management for contributing as co-host since the reformation of the Institute in 2022. This institution has taken a leading role in enhancing health management education in Romania, and I want to thank them for all the work they did. I look forward to the debates, and I hope we will have a very fruitful conference in Bucharest, and also we will discover, for those who didn't visit Romania yet, a very friendly, nice, and good food from Bucharest. So welcome in Bucharest. Thank you.
Thank you very much, Minister, for opening this conference, but also for your leadership in this reform in health services management. It's a process, the project is still ongoing, but we can already see changes in Romania, and that's very important. I would like to also introduce for the opening another person that spearheaded this project and this reform. As Minister introduced already, the National Institute of Health Services Management, an institution that was reformed 2 years ago, and now it's performing as the spearhead of our national system in the area of health services management. Professor Cristian Blădescu, the Director General of this institution, please, for the opening remarks.
Good morning, and first of all, thank you everybody who make it to be here in this morning. I hope will be an at least interesting experience for everybody from Romania and also from abroad. I will first want to thank both the organizer, international organizer, the Ministry of Health. I may say that it was the initiative of the Minister of Health. Last year, he sent us, meaning us, the leadership of the Institute, to Rome to discuss and to accept to co-host this conference in Bucharest, and we are very pleased to see that this happens. I also want to thank to the WHO. I would say that this whole meeting, this whole conference is part of a bigger project in which we are involved, a bigger management project in which the Institute of Health Services Management, together with the Ministry of Health and with the EHMA, it's involved starting from 2 years ago. A project which in itself is a management project because involves multiple stakeholders from different levels, both national and international levels. International levels meaning WHO regional office, EHMA at the local level involves multiple stakeholders and in different layers from the political layer, the Minister of Health as part of the top management, but also academic level, universities of medicine and pharmacies from Romania, and also managers, representatives from different hospitals in Romania. And the project in itself, as it was mentioned, it's part of a bigger approach of reforming the management, reforming the health system in itself, and part of it, the management of the health system. And the focus is on the training of the managers also from different training of managers have been done, as it was mentioned, in the last 30 years since the institute was established in Romania, also as a international project with the old bank at that stage, but also managers for different type of organization, from district health authorities, hospitals, primary healthcare offices, ambulatory care, health, let's say health authorities from local level, and also the paying body of Romania, which is the health insurance house, the health insurance system, both at the national and at the local level. And as you all know, the healthcare system, it's a complex system. So as in a disease, we first have to understand how it works, when it doesn't work properly, what are the causes, and after that to try to address the needs of the system. As I already mentioned it, there are multiple stakeholders, both national and international, local and national, from the day-to-day care level and also from the academic level. So all of them are intertwined, and to have a successful reform, all of these different types of stakeholders and different types of needs have to be addressed. Looking on the program, I saw that we will have cover most of those areas, meaning both academic areas belonging more to the public health, the traditional public health area, I would say, but also a focus on the management field with concrete examples. And for the training in management area, there will be also sessions. And I hope you will participate, those who are interested in it. At the end, I want to thank again for the organizers, the EHMA, and the support of the Ministry of Health and the WHO. And I'm sure that we will have an excellent conference, because as it was mentioned, the weather is taken care of. So everything is under control. Thank you.
Thank you, Professor, and sorry for using your joke in the beginning. It was too good of a joke not to use it as an opener, about the weather, I mean. And thank you for everything you are doing. Next, I would like to introduce a very good friend of ours here in Romania, because he is involved in multiple projects in Romania, including projects in the area of health services management, but also health workforce and others. And I think he's been in Romania more than 10, 20 times in the last few years. So he's already a local. I would like to give the floor to Dr. Thomas Zapata, Unit Head of Health Workforce and Service Delivery at the WHO Regional Office for Europe. Thomas.
Thank you so much, Theodore, for the introduction. Honorable Minister, Professor Rafila, it's a pleasure to be here. Professor Bladescu, Professor Buttigieg, esteemed colleagues and dear friends, it's a pleasure to be here. I'm on behalf of our regional director, Dr. Hans Kluge, also Dr. Natasha Sopardi-Muscat, the Director of Country Policies and Systems, and the WHO representative, Caroline Clarimbal. It's a great honor to speak here today with so many and good experts on health service management across Europe. And I thank the team of EHMA for the excellent organization of this event here in Romania. Here in Romania, substantial and innovative steps have been taken to redesign the country's health system under the leadership of Professor Rafila, to align its services with the changing needs of the population and to ensure that it remains fit for the future. I want to begin commending Professor Rafila's vision, a strategic approach and a steadfast partnership that has led to the finalization of a new National Health Strategy 2023-2030. The involvement of WHO in the reform of healthcare in Romania started in 2021 with an ambitious plan for 2026. The implementation of the National Recovery and Resilience Plan, or NRRP, as I think you all know it. And we are now in the middle of the project, with WHO and the Ministry of Health really working hand in hand at the strategic level to ensure the delivery of key initiatives of the plan. And I would like just to mention some of the achievements that so far have been delivered under this common cooperation and work. We have seen the development of the National Digital Health Strategy, the National Health Workforce Strategy, the National Patient Safety and Quality Strategy, and now we are also planning for the National Health Workforce Registry. We are also planning for health professionals and how, building on the Bucharest Declaration, as Professor Rafila mentioned, in March last year, we were all here in Bucharest with multiple ministers for health, heads of human resources for health units, and we went for the Bucharest Declaration that really elevated health workforce into the central political agendas we see in the last EPSCO meeting, for example, in the European Union. The registry that I was referring is essential for planning. It will help us in better understanding the numbers, the distribution, the quality, and the skill mix of the health workforce in Romania. This, in turn, can help build a stronger, more empowered health workforce and lead to a more efficient delivery of health services. Focusing on health managers, as is the main link with the work that Romania is doing and the EHMA conference, the health service management component, we have finalized, as Professor Bladescu mentioned, an ambitious train-the-trainer program, targeting more than 100 healthcare managers and professionals through our great partnership with the National Institute of Health Service Management. WHO has also developed an excellent consortium to improve health education in the country, and Minister Rafila already mentioned, involving EHMA, also Nova School of Public Health, IESE Business School, Barcelona, and the University of Milan. I want to take this opportunity to really say a big thank you for the members involved, Professor Lorenzo, Professor Jaume Rivera, Professor Leda, also my team, Mafate, Hamis, Ioana, Bogdan, and of course, the Minister of Health, Alex, Theodore, Dragos, because it's been a real pleasure working and joining together in this adventure. And from the National Health Service Management Institute, Professor Bladescu, Aurora, and Gabriela as well, thank you so much. We have all worked together to develop an updated curriculum and training modules for both current and new health managers in Romania, some of which already been delivered by the Institute led by Professor Bladescu. At a broader level, I want to mention two very important initiatives of WHO. One is the 14th General Program of Work that sets the high-level roadmap for the global health and will guide WHO work in support member states in the region and partners in 4 years in the period 2025-2028 to reinvigorate actions needed to get the health-related sustainable development goals on track while prove future health and care systems for the post-SDG era. Second, in December 2023, we celebrated the 15 years of the Tallinn Charter. WHO Europe, together with the Ministry of Health of Estonia, organized a high-level health systems conference in Tallinn entitled Trust and Transformation, Resilient and Sustainable Systems for the Future. And here I think the topic of the conference really fits well under this theme. And finally, we must not forget, and this is something that Dr. Hans Kluge, our regional director, always underlines, resilient health systems are essential for achieving universal health coverage. They can also effectively prevent, prepare for, detect, respond to, and help countries recover from emergencies and public health threats. And indeed, with this in mind, we have been collaborating over many years with government health bodies, healthcare providers, and professional organizations, and united in tackling important health challenges and strengthening health systems resilience in Europe. And as you will know very well, we can build new shiny hospitals with amazing technology and equipment, but without well-trained health managers and their teams, so the health workforce will not have nothing. So I think it's really important that we put in value healthcare managers and the health workforce to really be able to make a difference. And as part of our collaborative partnership with the Ministry of Health of Romania, we can now talk confidently about the Romanian model in health workforce, health service management, quality of care, and digital health, all showcasing the robustness and effectiveness of the NRP project. So dear friends, as we continue our joint road of transformation underpinned by resilience, collaboration, and communication, trust is what we need to earn. The trust of the health workforce and the trust of the people we serve. On behalf of WHO Europe, I want to reiterate my gratitude to everyone contributing to the success of this conference, and I also want to express my sincere thanks to EHMA, not for just organizing this crucial event, but for being involved as well in this RRP Romanian Health Project and moving forward. EHMA has recently been going through some changes, and these changes are important to keep looking at the future and to keep moving forward. And I think this is a great opportunity to really look at the future and come out more strengthened. So really looking forward to working with all of you. So thank you so much today, especially to all of you here, all the expertise, all the knowledge, all the country experience coming from all of you, and really looking forward having very successful conversations and discussions so that we can really strengthen health systems in the region and, at the end of the day, improve health outcomes for the people in our region. Thank you so much.
Thank you very much, Thomas, for you and your team's involvement in this conference and in all the projects in Romania. It's been a wonderful collaboration, and it is. Now I would like to, first of all, thank all the speakers for the opening ceremony and the motivation that they gave us for the next 2 days. And I've been thanking people and institutions this whole morning, but I would like to also give a very important thank to you all for being here, for taking the time, and the plane to be here in Bucharest and be part actively of the next 2 days and to share your expertise and knowledge. We are grateful for that, and we appreciate it. I would like to also invite you, if you are tweeting during the conference, to use the hashtag EHMA 2024 and to use the conference app to get all your information regarding the sessions, the locations, and everything else. And if you cannot find something on the app, I'm sure you can ask the EHMA colleagues, but everything is there, trust me. I would like to also remind you that at 11, so in 20 minutes, we have the first round of parallel sessions, which will be in the library, which is the building next door, right left when you exit this building. But as every good thing, great thing, we will start with a break before the parallel sessions. So now we have a break for 20 minutes, and the parallel sessions will start at 11. Enjoy the conference, enjoy the next days, and let's have a fruitful meeting together. Thank you.